Pearls of history taking. Let's divide it into 4 steps. Step 1, starting the session. Step 2, information collection. Step 3, explanation and planning. Step 4, ending the interview. Let's get into detail of each section one by one. So, let's start with step 1, starting the session. Greet the patient, shake hand, confirm the identity of patient whether you are talking to the right person. Introduction of yourself and your role in this interview. Start with an open questioning. Is it all right if we discuss the complaint why you are here in hospital? Or how can I help you today? Talk less and listen more. Try not to interrupt the patient as you may not miss the valuable information. Ask about the reason for consultation. Once patient has finished speaking, better to summarize the key features and ask if he wants to add something else. If the patient is talking about more than one complaints, identify the problem that is new onset and causing more trouble or brought him hospital. You may say, let's talk about the sudden onset chest pain first and we will talk about the chronic cough later. Elaborate agenda for session. After appropriate starting of interview with patient, the next step is information collection. Step 2. Lead the interview from open to closed questioning. You can simply say, tell me more about your symptoms. Then narrow it down to closed question like how did it started? If patient had a pain, ask about how is he feeling now. Show sympathy accordingly. Appropriately respond to the nonverbal clues as well. If you are confused about the complaint, you may ask the patient to explain or what exactly do you mean by this symptom. Active listening is the key of medical interview with the patient. Take pauses or intervals when appropriate. Try to be as comprehensive the patient and avoid pure medical terminology. Explore ideas by asking what is the patient's understanding about the cause of this problem. Then, concerns, by asking do you have particular concerns or any this in particular you are worried about. Finally, expectations by asking what do you see happening to yourself after treatment. While interviewing with patient, try to use transitions while asking about presenting complaint to past medical history to social history. For example, saying, now I want to ask few questions about your health in the past. Is that all right? Furthermore, while talking about private life of the patient, use the phrases cautiously and observe the dignity of the patient. Check understanding at various levels during the interview and encourage the patient as well. At this stage we have some clue to the problem of the patient, so it is time to make further plan regarding investigation and treatment. So we are now at the next step, explanation and planning. Shared decision making. You may say, I can see you are worried about this particular thing, but let me explain the issue from my perspective so that we can make this decision together. Finally, we will send the session by coming up at a stage of mutual understanding. Meanwhile, it is also the time to address any unanswered question by the patient. Ending the interview. Agree on a mutual plan of action. Summarize session and plan. If there is no suitable treatment option available, you may honestly talk the patient about it like that we don't know the best treatment till now, and explain clearly what will be the role of prescribed treatment. Ask about any further inquiries. Try to keep yourself in the structured framework for conducting the medical history taking interview with the patient. Well, hopefully at this step we are ending up a brief overview about dealing with the patient and standard approach in conducting the medical interview with patient, that is the cornerstone of a doctor-patient relationship. Further, we will discuss the component of history taking and explain how to deal with variety of presenting complaints ranging from chest pain to collapse, as well. Till then, take care of yourself and keep your knowledge boosted. Thank you for joining us.